Pulse examination comes first in Ashtasthana Pariksha. Ashtasthana Pariksha means 8 focus of examination. And pulse examination is the most important one. Pulse examination is enough to estimate the other examinations also. Or what all specific examinations have to be done. Pulse examination will tell you. For example, Janmantara Kritam Papam Vyadhirupena Jayate. Nobody can give a history of his Purva Janma. But an adept Ayurvedic physician who knows pulse examination can find out that also, if needed. It's not a routine, but if needed, that also can be brought about. Pulse examination is not described in the text very well, only mentioned, because it is to be taught by a guru to a deserving shishya. It cannot be shown like, for example, ECG can show everything in a gadget. The entire thing can be. But this cannot be. That way it cannot be presented before a student. It is to be shown by the guru to a patient who examines, and the shishya also examines, and they interact. Thousands of this type of examination is required to transfer the knowledge. It can come from life to life, not from book to life. That's why curriculum doesn't have pulse examination. Nadi Pariksha is not there. Nadi Pariksha is the most important examination that is not being included in the curriculum of Ayurveda. Yes, the thing is, pulse examination was prevalent in Ayurveda all over India. You understand? The downfall of Ayurveda started in the 11th century AD. To that point, the pulse examiner is the most important examination. All Ayurvedic physicians were doing that tool for diagnosis and treatment. Even now, so many pulse examination books are available. None of them conceived the actual concept behind pulse examination. Now anybody can write anything about pulse examination. Understand? Because that knowledge, that sacred knowledge, is not properly transferred.
What all do you see in pulse examination?
In modern language, we can say that it is epidemiology. A patient comes with cough. I am giving an example. Or some respiratory symptom. We examine the patient. We can find out how it happened. One example I can say. One patient came with hemoptysis, with blood in the sputum for years together. All the specialist doctors examined and they gave medicines. None acted. We examined the patient and found out that it is the continuation of more than 33 years while he is an agriculture worker. His own land he was cultivating. Some new place he was digging with a spade. He found out a very big, more than 100 kilos, a slab of granite. And from one corner, he tried to lift it up. And he could not manage. 1 inch or 2 inch he could lift. But he felt something uncomfortable in the chest. While interrogation, he expressed that. And within 2-3 days, it started. This hemoptysis. And it's almost same. If he is tired, this will be more. While chest pain was there. It could not be localized where it is. Discomfort in the chest. Post-traumatic, and it is willful.
A willful post-traumatic incident was identified through the pulse examination, including the time of the incident. Is that what it is? Year of the incident. And the patient, through interrogation, recollected this particular incident.
Yes.
I see. Okay.
So that specific epidemiology of the condition is very important for correct treatment. That much specific it is. So none of the modern gadget can do that.
Then what happened? You did treatment?
Treatment for about 100 days we have given treatment. He is still active. Never had that condition.
I see.
This is one instance from US. A post-operative case came to me for 4 years back. After 30 days of operation, brain operation, a tumor was there. It was removed and she was blind. On pulse examination, I could make out that it was older than herself. By birth it was there, and it was there in the intrauterine life also.
The tumor.
The tumor. Cause of the tumor. And on interrogation, she could recollect that her mother, while standing on the bus station, she slipped while she was pregnant. About 30 weeks of pregnancy. The gynecologist was very doubtful whether the fetus can be saved. Somehow or other they managed. She had a normal delivery and she grew up. But the tumor was there from the birth itself or intrauterine life itself, and it grew the size of a tennis ball. Brain would accommodate that. So, pulse examination brought out the epidemiology of the tumor.
Okay. So this tumor was on the optic chiasma of the patient?
Yes, yes.
And during the operation, they could not remove the entire tumor?
It was not fully removed.
Fully removed. And it also caused blindness of the eye?
Yes, he was blind. And so many symptoms were there.
Including tunnel blindness?
Yes.
So,
and we treated the patient. She got back the vision. And second examination, after post-operative examination, doctors were wondering that her improvement, clinical improvement was so fantastic. They never expected that. So the vision came back.
So the modern doctors could only remove part of the tumor and they had no prognosis for her vision to be...
Yes.
To get back.
Ruled out.
Ruled out.
the possibility. So the correct understanding of the pathology is very important in Ayurveda, for any system. Then we can do the proper therapeutic measures to make the person normal.
Sir, you must be having hundreds of interesting cases like this where you found out through pulse examination what is the correct cause of the problem. Are there also cases where you cannot find out the cause of the problem? For example, multiple sclerosis, the cause is unknown. So how do you treat MS patients?
So most of the cases, the pathology starts on emotional outbreaks. Some causes may be there. That retrospective pulse examination will reveal that when it started. That is very important for multiple sclerosis. They might have diagnosed recently, 2 years or 3 years. It may be much more than that. The causative factor, triggering factor might have happened 10 or 15 years back.
So you are telling that diagnostic technologies that we are having diagnoses or establishes the disease much later, but the disease would have started to develop much earlier to that.
Yeah, much earlier.
And that could be identified from proper pulse examination.
That is very important to judge the time of
onset.
Time for total recovery. Recovery time will be longer.
One more thing, sir. When you are trying to treat diseases of unknown etiology, are you saying that for each patient, of course, the cause will be different, right? So we all know that demyelination happens in multiple sclerosis, but for each patient, the cause might be different. Is that what you're telling? And that can be identified from the pulse?
Yes.
For some persons, it could be traumatic. For some person, it could be
emotion. So many factors may be there.
And when you give medications, you remedy that factor?
Yes. That also will be considered. That's why we have no medicine for a disease. Because it is manifold.
So from the pulse, can you make out which all system is affected?
Yes. Which all system, how it happened, and some accident, especially trauma cases. And that one patient is now in ICU, home ICU. That patient met with an accident. We examined the patient after 1 year, 3 months. The hospital authorities were not willing to give Ayurvedic medicines. And his own cousin was in the hospital, a doctor, but he also could not. If he started the medicine immediately after the accident, he would have rescued very easily. Unfortunately, he required about 2-3 months to get discharged with a ventilator. He was examined in Delhi, our Delhi center. He came in the ambulance and examined, and we could find out that at the time of accident he was drunk. On interrogation, it was proved.
And why was that important?
That's important because the damage happened.
When he was inebriated.
The reparative process will be slowed down. If he was not drunk, the repair will be faster. It will take a longer time. He was having axonal injury. And that specific anatomic change is very important for it.
Sir, do you also see the doshas of the patient?
Yes. Whatever is required for a treatment of the person, everything we can bring out from the pulse examination. Indian way is like that. We say everything at first. There is no parinama gupti. We don't do anything hidden. We tell everything. For example, yoga The historical facts are everything was given in the first sutra. Second one, what is yoga? Yoga is chitta vritti nirodha.
Working with you, I noticed certain important things that you identify through the pulse. You usually tell the maternal factors, paternal constitution of the parents. You try to identify if you find some genetic cause in the patient. In some patients, I noticed that you look at environmental factors. We had gone to a place called JK Cancer Institute to do a research on cancer patients. And from the pulse, you were able to identify that certain persons were exposed unusually to heat and sunlight. And through by checking with the patient, we found out that they work in the hot sun digging on the ground. One person, you identified occupational hazards, that they were exposed continuously to noxious fumes. And the patient said that yes, he works with metal, he works in the metal industry, and he's always exposed to chemicals. There are other factors also that you identify, emotional factors, whether any emotional trauma, including physical trauma, is there for the patient. There were cases of rapes that have come to our institution where the patient has not revealed. From the pulse, you'll be able to find out that the patient is being harassed physically and emotionally. In gentle interrogation of the patient, we'll be able to find out that the patient has been raped. There are many cases where you have identified trauma, starting from intrauterine period. You have identified the time of the trauma, extent of the trauma. So there are so many aspects that you are able to identify from the pulse. How do you correlate all these things for the treatment of the patient?
So the modern examination, one of the important things is interrogation, asking some questions. When it started, all these things are. It's personal. That's also, we also accept asking questions to the patient. Therefore, that depends on the memory of the person. They totally depend on the memory of the person. Understand? And so many factors are not known to him. Whatever is known is being brought out. A retrospective interrogation. What happened 10 years back. At times, modern medicine, also modern doctors use that. Retrospective, the interrogation. Retrospectively. All these are limited. He may not know all the important things, how it happened.
So you're telling that through your pulse examination, whatever is relevant,
Yes.
you're able to pinpoint from the
Yes,
pulse.
yes.
Even those things where the patient do not remember or cannot remember. For example, it happened in the intrauterine period. Sir, one more thing. When you look at the pulse of a person, you find out so much of personal information about them.
Yes. Everything we can see. It is biodata exposed. We are not interested. We forget immediately. If you ask next minute, I will not be able to recollect all these things.
So is that also part of your training?
Yes. Why should we keep it in the mind? We never know that. Previously, because of the interrogation only, it started.
Sir, you mentioned that from the pulse examination, you can find out the Purva Janma of the person.
Yes.
Do you see that for all patients or only during Sanya?
Very, very rarely it may be required.
Can you tell some instances where it might be required, sir?
So, especially mental disorders. Mostly mental disorders. Certain conditions, especially skin conditions, psoriasis, and some chronic skin conditions also. These, because skin and nervous system are very closely related. So it may be required for an efficient treatment.
So when you see the pulse of a patient, you can see everything about them. There can be instances where the patient has been emotionally traumatized, physically
So
traumatized.
many things will be there.
Does
We
it?
don't give any importance to that. For example, I can tell you, If you are going to nursery school, hundreds of children will be there. Among that sound, you can make out your child. Same way. What is important for the person? What aid you have to give to rescue him from danger or make him normal? You have to do that. Other things we are not bothered at all. So many things which a husband may not know, wife may reveal. Vice versa also. These are rubbish for us. Why should we keep? Immediately is given, the prescription is given, is over.
Sir, pulse examination can also be used to find out if the patient is doing treatment properly, having medication properly.
Yes.
Will they
Even
respond
the ingredient
properly?
of the medicine. If, for example, our medicines are very simple, water extract or whatever it be. If one ingredient is not correct, I can make out on the pulse that ingredient is not good.
You mean not good quality?
Good quality. You have not taken the medicine properly. Everything we can tell. The thing is, in our ashram, we never ask anything to the patient. Only from the pulse we examine and give the prescription. Never ask anything. Fortunately or unfortunately, when I joined medical college in Kottayam, in 70 Gandhi Jayanti day, one eminent person, I respect him so much, MP Manmathan, that's a Gandhian, and he came to me with some of his relatives, one girl, and he told, I have heard that you are treating patients very successfully. So many people give very positive report about you. But everybody is complaining, you never talk anything to them. So they are not used to that. So they feel very uncomfortable. So whatever they have to say, let them say. You don't give any importance to that. Give some time for that. I told it is not in our heritage. In heritage we never do that. It's not necessary. If pulse examination is not convincing, we examine again. That's all. We never ask anything. That's our way. I asked my guru, do it. That time almost it is so time consuming. I am not used to that. Pulse examination, give the prescription within 5 minutes, it will be over. So we started. I am the only person in the ashram, among 5 disciples. I am the only person who is doing this. Nobody is doing that. So that is actually burdensome.
So my next question, what all do you see in the pulse? So in modern medicine, they call it as rate, rhythm, volume and character.
Yes.
So how do you describe your
All
pulse?
these are important. The combination of that, like an individual, for example, thumb impression is unique for the person. Very, 1 in 10 million may be similar. The same way, this is an impression of the person. I can identify a person from the pulse. I may forget the person. Face, I may not recollect. When I examine the patient second time, I can tell that I have examined the patient. The tactile sensation is developed like that.
So you're saying that his pulse is unique to him.
Yes. That pulse I have examined you.
Can you call it
No modern doctor can
Is it the
say
rate of the pulse that is different or the volume?
Character of the pulse.
So to what extent is modern medicine modern medicine has described about character, and to what extent does
There are pulse examination, big volumes of books are there.
So are those what they've written in those books relatable to what you see?
To some extent. Some pulses, gallop rhythm, so many rhythms mentioned in the cardiology are useful for us also.
Okay. Pulse examination in modern medicine comes under cardiology.
Yes.
In Ayurveda, does it also come under cardiology?
According to Ayurveda, the anatomical base of the human system is different. We have got, according to Hridayam Dvivitham Praptam, two types of hearts are there. We have got two hearts. One is thoracic heart and the cranial heart. Pulse examination also in that way two types. Nadi Pariksha and Nali Pariksha. Nadi Pariksha as a cord. It will come under neurology. Nali Pariksha, that's the conduit pipe. That comes under cardiology. Nali Pariksha is Heya Hridayam, and that is thoracic heart. The cranial heart is Upadeya Hridayam. So in retrospect, we have to go. Retrospectively, we have to bring out the cause of the disease. It must be Upadeya Hridayam. So Heyopadeya Hridayam, that examination is amalgamated. Pulse examination, it is not independent. That is well united, well tailored, and we give the correct picture of the. My guru requires few seconds.
Sir, how did you learn about pulse examination in your ashram, sir?
I thought that simple way. When we were our ashram, we were having more than 100 workers there, or live together, ashram life. First, Guru taught me how the pulse is to be observed. Then you have to examine ashram inmates as many times as possible. There was no description at all. Pulse, rhythm, rate, nothing. This is the way of pulse examination. Each individual can be identified with pulse examination. Without hearing the sound, just with touch we can make out. That's the first thing. In the course of 2 years, I could make out all the inmates by pulse.
First, you are taught to identify the unique pulse.
Person,
yes.
Only the concentration on the tactile sensation. And our own pulse we examine. After food, before food, when you are sad, examine. Immediately before sleep, immediately after sleep, when you get up, that will come. That pulse examination become a habit. So you will get more and more. You will get acquainted with that. It is abhyasa to examine thousands of patients in thousands of conditions.
When did you first examine another patient? Or when did your guru allow you to examine another patient?
In his presence, when the tactile sensation developed, after that gradually some important patients will be shown and he will ask the description of the pulse. Very gentle way. The thing is, the way in which my guru taught me, I cannot imagine to go to that state. So expressive. That way I'm incapable. that much.
So did you have examinations in your ashram? Like the guru would test your knowledge of the pulse? Like for example, first you said we were taught to identify the individual. Was there any examination to evaluate that?
It's not examination. It is actually some, just like, not like examination. It is very spontaneous. We are blindfolded. Examine the patient, only the pulse exam. We can make out the person.
Right.
All the inmates.
Sir, can you also find out from the pulse what yogasana or pranayama will be useful or helpful for the patient?
No, yes. Yoga and Ayurveda are integral part. Inseparable. Actually, pulse exam, the precision of the pulse examination comes from yoga. You have to practice yoga systematically. Especially pratyahara dharana dhyana. Pranayama. Pranayama is very important. Pranayama parayana. So every examination, the pranayama is there. Inbred.
How, sir?
These things are, I don't want to describe now. These are certain sacred aspects. So how
But it is teachable, learnable, it is teachable.
Yes, teachable and learnable.
From a guru to a
From the
sishya.
guru to teacher, or to student. The sacred means it is not commercial secret. It is liable to be misused. That's why. So, aushadham, gopaniyam, because some medicinal plants, some very poisonous plants also will be there. It may externally resemble. That's why we don't show them. We take it and give. Not to hide it forever. No, it is not the intention. It is liable to be misused. Or wrong usage. Maybe harmful. That's why. We have no commercial interest at all in Ayurveda.
While conducting pulse examination, do you lose a lot of energy?
Yes. If you probe into more details of the patient, we use a lot of energy. Pulse examination is tiresome. So with the pranayama, we will recoup. It's not that much, not like working hard in the field or gymnastic exercise. No, it is subtle. You feel to take rest. That's all. It will be replenished immediately.